Most of us had never seen such deadly disease. People are trying to stay at home to keep away from danger. But meanwhile, there were lots of healthcare workers volunteered went to Wuhan to provide help.
Toronto was the epicenter for the SARS outbreak, so we had an already good understanding of how this could become a wildfire.
I'm working in a company about 31 years, 4 months, and then I live in Johor Bahru, next to Singapore. Every day I travel in and out Singapore until on the 17th of March, when Malaysia government announced that they are going to lock down. On that night, I come back to Singapore, but on the way that I can see people are rushing the checkpoint are terrible.
Before joining BD, I was a registered nurse. When this pandemic started to evolve, I knew that I had to step up and help.
During the epidemic, the medical staff and equipment were very deficient in Wuhan. So I decided to went to Wuhan while I realized I can help our customer fight the deadly coronavirus. Then I, with my colleague, drove about 1,000 kilometers from Shanghai to the boundary of Hubei province, because there have no flight and train due to traffic control. Then I walked through the boundary and took another car from Wuhan, went to Jingtan Hospital.
I remember walking into a dying patient's room, and as they were having their last breath, they were by themselves. They were completely alone. And I remember thinking to myself, we always want to do best for our patients. And at that point in time, the only thing that I could do for him was stand there and just hold his hand and reassure him that he wasn't alone.
I decided to come back to support the company because what I feel, business have to go on. That is part of our job. Ensure that we support the whole hospitals, these 7 years that we can deliver in time. That is first very important. At this situation where we know that few areas that are short of manpower, so we have to cover one another. We need to support one another.
Those people who are working in those manufacturing plants to be able to make products that we need desperately on the front lines. They're in a factory somewhere, or they're in a warehouse somewhere, or they're driving a truck to be able to get those supplies to where we need them. Just like me on the front lines helping patients at the bedside, they're essential workers. They are heroes that are unsung as well.